This chapter name Cultural Awareness and Health Practice. It is the fundamental of nursing care. Introduction, three keywords: cultural awareness, cultural diversity, and cultural sensitivities. So when we work in the hospital, we will get different patients or different people came from the different countries, different culture, or different religious belief, or different dietary habit and reaction. If you do not know the diversity, it would be difficult for us to communicate with the patient. Whatever my belief, it does not matter. We have to respect our patient belief. So cultural awareness include learning about the cultures of the client with whom you will be working. Also ask the client about their healthcare practice and preference. So cultural diversity, another keyword, is the difference between groups of people in a certain area. So definitely the people who living in Africa, the people who living in Europe or Asia is not same. That because of the different geographical location, different environment, people adapt with the demand or environment requirements, right? So cultural diversity means difference between the groups of people in a certain areas. Cultural sensitivities provide care of the patient with respect for their cultural belief. So, as an example, like Jehovah Witness, what they believe and what I believe or we believe, maybe it is different. Whatever it is, we have to respect their culture because it is their trust. Because of their trust, they get the mental space. As an example, I was, as far I told, Jehovah Witness, they no blood or blood product they accept, right? As a healthcare provider, if you know, if we aware about that, it would be easy for us to deal with my client. Let me talk about African American. So the citizen or resident of United States who have been origin in any of the black population in Africa. So communication members are competent in a standard English. So also head nodding does not always means they are agree or agreement. Or prolonged eye contact may be interpreted as a rudeness or aggressive behavior. Hmm? And also non-verbal communication may be important. So personal question asked on initial contact with a person may be viewed as intrusive. So while we deal with African American client, if you know about their culture, it would be easy for you to adjust. So what about the time orientation and personal space preferences? And what are the social roles? So time orientation varies according to the age, socioeconomical, economics, or subcultural, and may include past, present, or future orientation. Members may be late for an appointment because relationship or events that are occurrence may be deemed more important than being on time. Our members are comfortable with close personal space when interacting with family and friends. What are the social roles? So large extended family network are important. Older adults are respected. Many households may be headed by single parents women, and religious belief and also religious splits affiliation are source of strength. So religious belief or trust or spiritualities influence our own health. It gives the strength. So what else? African American belief about health and illness. Religious belief profoundly affect ideas about the health and illness. Food preference include such the items as fried foods, chicken, pork, or some beans, rice, right? And some pregnant African American women also engaged in PICA, health risks. So, what are the common diseases among the African American? What are the risk factors? Sickle cell anemia, it is a genetic defect, is a more common African American. Hypertension, heart disease, cancer, lactose intolerance, diabetic mellitus, or obesity, very frequent in African American descent. Intervention, assessment the meaning of the client verbal and non-verbal behavior. So your body language is a non-verbal behavior, right? The way you walk is a non-verbal behavior. So be flexible and avoid the rigidity in casual care. So if you will be flexible or if you not rigid, your life will be easy. Encouraging the family involvement, the caring of the patient, alternative modes of healing include herbs, care, or lying on of hands practice. Assessment each individual for cultural preference because there are many individuals and subculture variations. So if you go in Africa there are so many groups, okay, and their belief is different as well. So second beliefs group here, Amish population. Amish are known for simply living or plain dress or adopt of modern convenience or can be considered a district ethics groups. The various Amish fellowships or religious, they are Christian religious, I mean, uh, denominations. There forms a very traditional subgroups. So cultural beliefs and preference vary depends on specific Amish community memberships. In general, they have fewer risk factor for disease than the general population because of their practice of manual labor, their food habit, and also they do not use tobacco or alcohol intake. or risks of certain genetic diseases increase because of intermarriage. So good or bad together. Because of their simplicity, because of their food habit, and they do not smoke, they do not intake alcohol, so they can protect some disease like heart disease, atherosclerosis, lung cancer, right? But on the other hand, uh, some common genetic disease are more common in Amish population because of marriage in relationship, maybe second or third degree cousin can get married. Sexual abuse women is a problem in some communities. Diabetic mellitus can become a health issue and later in life and is related to the obesity that can occur. Continue. So communication. Usually they speak a German or usually they speak a German or called Pennsylvania Dutch or German language is usually used during the worship, or English also is usually learned in school. Time orientation and personal space preference. Members generally remain separate from other communities and physically or socially. And they often work as a farmers, builders, or homemakers. So they like to work so hard. They avoid sedentary lifestyle. Because of their hard working, they can prevent some diseases. Social roles. Women are not allowed to position of the power in any groups or organization. The roles of women are considered equally important to those of men, but are very unequal in terms of authorities. The family life has a um, structure, or they are they follow the genogram. Marriage outside is the faith is not usually allowed. Unmarried women remain under the authorities of their fathers. Health and illness among Amish communities. Most Amish need to have permission to hospitalized because of community will come together to help pay the cost, right? And usually Amish do not have health insurance because it is a worldly product and may show a lack of faith in God. And also health, lack of cost or language, transportation. Most do not understand the scientific judgment. Health risks, some genetic disorder because of intermarriage or non-immunization, they do not like to take the vaccine, or sexual abuse of the women. What are the interaction or intervention? Speak to both the husband and wife or unmarried women and her father regarding the healthcare decision. Health instruction or infrastructure must be given in a simple, clear language. Teaching should be focused on health implications associated with non-immunization or intermarriage or sexual abuse issues. It is good to be alert to those regarding eye contact, personal space, time concept, and understand of the recommended plan of care. And next group here, Asian American. So American, American of Asian descent can include ethical groups such as Chinese American, Filipino, Indian American, Vietnamese, Korean, Japanese. So on other those nation origin in Asian continent. So communication, the language include Chinese, Japanese, Korean, Filipino, or Vietnamese and English. So be silence is very valuable. So silent is meaningful, right? And if you touching is unacceptable with opposite sex, and head is considered is very respected or do not touch the head. They believe in yin, yin, also yang, the two keyword, and they prefer warm, considered good for wellness. So eye contact may be considered inappropriate or disrespectful, and criticism or disagree is not expressed verbally. And also head nodding does not always mean agree. The word no may be interpreted as a disrespect for others. So time orientation and personal space preference. Time orientation reflect the respect for the past, but including emphasizing of the present and future as well. The formal personal space is preferred except with the family and close friends. Members usually do not touch an other during conversation. For some cultures, touching is unacceptable between members of opposite sex. Head is considered to be scared in some culture. So touching someone on the head may be disrespect. It is good to not touch the head. And some social rules. Members are devoted to the tradition. So they like to follow their tradition. Large extended family network are common, or loyalty to immediate and extended family and honor are valued. The family unity is structured, and men have the power and authorities. Women are expected to be obedient. Education is viewed as important, and religious include they like to believe Buddhism or Confucianism, Hindus, Islams, and Christianities. And social organizations are strong within the communities. For the health and illness belief in Asian Americans, the health is a state of physical and spiritual harmony with nature and a balance between positive and negative energy. So positive and negative, they use two keywords. One is called YIN. So YIN means dark and cold. And Y and young, it means bright something hearty, right? And they do not mix hot and cold together. Usually they do not. A healthy body may be viewed as a gift from God. Illness may be viewed as an imbalance between hot and cold, or yin and yang, or imbalance between dark and bright. Illness may be also be attributed to prolonged sitting or lying or over exertion. Food preference include raw fish, rice, and vegetables. Some note: yin foods are cold and yang foods are hot. So once eat cold food when one has a hot illness, and one eats hot foods when one has a cold illness. What are the risk factors? Hypertension, heart disease, cancer, more common in Asian American. Lactose intolerance, like African American, also lactose intolerance are common in Asian American. Thalassemia, common in Asian American, but sickle cell anemia more common in African American. So intervention, be aware of and respect the physical boundaries, and request permission to touch the client before doing so. Also limited eye contact. Avoid some gesturing with hands, or female client usually prefer a female healthcare provider. And also clarify response to a question and expectation of the healthcare provider. Be flexible and avoid rigidity about this casual care. We encourage the family to get involved in the care of the patient. Alternative modes of healing include herbal medication, Chinese medication, traditional medication, or acupuncture, or restoration of some food, massage, or offering a uh, meditation also good. If the healthcare recommendation, intervention, or treatment do not fit within the health cultural values, and they will not be allowed.